Well, September Prostate Cancer Awareness Month, and during our last half hour, we introduced you to a cancer survivor. Now we are going to talk about an emerging cancer treatment offering new hope to patients. I'm joined by Dr. Nik Patel of the Scripps Cancer Center to tell us more all about this emerging treatment. Doctor, thanks for coming in. Really
Thank you
appreciate
for
it.
having me.
So this is targeted theranostics, but we're calling this smart bombs. It's a very catchy way of talking about a really increasingly opportunistic treatment, right? There's a great opportunity for recovery.
It is. It's treatment meant for advanced prostate cancer patients. It has been known that even though prostate cancer incidence is increasing at 3% per year for the last decade, advanced prostate cancer is actually increasing faster at 5% per year.
Okay.
And those patients in advanced prostate cancer, the disease is spread out through their body. And what this is a therapy that the technical term is theranostics, but smart bomb is really what it does. And what we first do is we put an infusion into the patient that targets the PSMA receptor on the prostate cancer cell. It then identifies where those cancer cells are in the body. We then do a second infusion that has a radiation associated with it that targets those cells and kills those actual cells.
Wow, you were talking about patients who have had to go through chemo or whatever in the past. Comparing it to this is a whole different way of doing things, right?
Yeah, this is very well. Even though it's an infusion, so it is invasive through the blood. It is very well tolerated compared to chemotherapy. You don't have the hair loss. You don't have all the other side effects because you're only treating those cells that have the cancer. You're not treating all the other cells. The normal cells in the body do not get affected. So because of that, patients hardly have any side effects from it. A little bit of fatigue for a week, maybe a little bit of dry mouth.
Wow.
But other than that, most patients tolerate extremely well.
It's like a 1-2 punch.
Exactly.
As I've referred to it as.
And, it is multiple cycles. We have 6 cycles of therapy.
Okay.
We give it 6 weeks apart. But generally patients tolerate very well without minimal side effects.
My dad went through this the past year. He's a prostate cancer survivor. I sent him this technology, thought it was fascinating. This is going to help a lot of people for many years to come.
No, it definitely, it's developed since 2022 we've had it. But since 2023, it's really been becoming more mainstream to be considered for these patients with advanced disease.
Yeah.
And going forward, it's really, I think, going to be a key component to treat those patients with advanced cancer.
Absolutely.
In fact, this year, it's been so effective. It used to be a third-line therapy after patients had a chemotherapy. Patients don't need to do chemotherapy anymore.
Interesting.
You can actually get this after the first-line therapy fails. And that is actually a big difference that since this spring of this year has been allowed.
Incredible. PSA, knowing that number, super important, right, to catch things before it gets to this advanced stage.
Exactly. And this is actually one of the ways that they detect it. When patients have had previous treatment and their PSA is dropped, as it slowly starts to rise, and the doctors say they may not know where the cancer is, but they know it's recurring.
Okay.
And we can provide this treatment and find those cancer cells in the body.
How often is this being used now, and what's next for this type of therapy?
So currently, any of the patients that have this advanced prostate cancer situation where it's spread outside of the prostate gland, elsewhere in the body, could be in your bones, could be in your liver, if the candidate is expressing it, and 80% of patients with prostate cancer will express this receptor type, it's a viable treatment for them to consider.
Wow, fascinating. Can you give us a website, or if people want to learn more? Because there's a lot of research that I know when people get that diagnosis, they want to look into their options.
Yeah, definitely. You can go and call 1-800-SCRIPPS, okay? Or you can also go to scripps.org/cancer, and we'll be able to direct them from either of those two areas.
Very impressive. We have some smart people behind these smart bombs here that are helping a lot of men here in their recovery. Really appreciate your time, Doctor. Thanks for coming in.